This quick guide video explains how to prepare the patient for eABR testing. The preparation of the patient for eABR is quite similar to preparing the patient for a traditional ABR, with a few exceptions. Standard ABR surface electrodes are usually sufficient for acquiring eABR recordings. In ABR we typically record using a 4-electrode montage, but in eABR a 3-electrode montage is preferred instead. Here you can see the recommended montage for eABR. Because the cochlear implant is an electrical device, it will produce a large electrical artifact. Because of this, it is recommended and accepted practice to place the reference or inverting electrode on the contralateral side to the implant. By doing so, this reduces the electrical noise contamination from the cochlear implant. The ground electrode can be positioned on the forehead. However, sometimes it is more beneficial to place the ground closer to the cochlear implant on the ipsilateral mastoid of the implanted ear. This helps the preamplifier to further reduce noise recorded from the electrode sites. When testing auditory brainstem implant patients during surgery, a midline electrode montage is recommended. The active electrode should be positioned at CZ, the reference electrode on the nape, and the ground at C7. Once you have decided on an electrode montage, each electrode site needs to be cleaned and prepared in order to reduce the skin impedance. It is recommended to have impedance values at or below 3 kiloohms to produce clean recordings. If this cannot be achieved, then ensure that the impedance between the electrode sites are similar. An important tip for eABR is that it is essential to place the electrode cables and the preamplifier as far away from the cochlear implant connections and cables as possible. This will minimize electrical interference. As the eABR is not affected by anesthesia, it allows for testing in multiple environments, including the operating theatre and clinic room. Optimally, the patient should be lying down asleep and in a quiet environment. If this cannot be achieved, particularly when performing post-surgical mapping with adult patients, then it is recommended that they should at least be relaxed with their eyes closed during testing. Lastly, when testing in the operating theatre, where there is typically a significant amount of interfering noise sources, then it is recommended to ground the operating table to the evoked potentials device to minimize this noise. This concludes this quick guide video, which explains how to prepare the patient for eABR testing.